Welcome to a deep dive into the fascinating world of feline spinal health. Today, we're exploring a research article published in the Journal of Feline Medicine and Surgery, focusing on a surgical procedure known as partial lateral corpectomy, or PLC, for treating intervertebral disc herniation in cats. This study, conducted by Tyrer and colleagues, provides valuable insights into the safety and effectiveness of this relatively uncommon surgery in our feline friends. The introduction to the study sets the stage by highlighting that intervertebral disc disease, or IVDD, is not as common in cats as it is in dogs, with a reported prevalence of only 0.12 to 0.26% upon admission to veterinary hospitals. While it's true that intervertebral disc degeneration is often seen during post-mortem examinations of cats, particularly in older ones, associated clinical signs are actually quite rare. This means that while many cats may have changes in their discs as they age, very few will actually experience clinical problems because of this. The article goes on to explain that when chronic disc disease occurs, the disc material can protrude and become firmly attached to the surrounding structures, making surgical removal a challenge. This is due to the material being attached to the annulus fibrosus, which is secured to the dorsal and ventral longitudinal ligaments of the spine. The surgical removal then becomes challenging. It can be difficult to remove this material without causing additional trauma to the spinal cord and ensuring complete removal of the herniated disc. The researchers note that a technique known as thoracolumbar lateral corpectomy, or TLLC, was first developed in dogs in 2004 to remove disc material ventral to the spinal cord while minimizing the risk of spinal cord trauma. This involves creating a lateral slot through the vertebral epiphyses of two adjacent vertebral bodies and the intervertebral disc. This approach has become a viable option for dogs with chronic disc issues. The study then points out that there are only 3 case reports describing partial lateral corpectomies, or PLCs, in cats published in scientific literature prior to this study. The first PLC in a cat, described in 2008, was performed to treat a ventral extradural thoracic spinal cord compression at the level of Th3-4. The other 2 cases combined hemolaminectomy and partial corpectomy to remove a vascular hamartoma and lateral corpectomy combined with foraminotomy to treat chronic intervertebral disc herniation, IVH. The rarity of the procedure in cats underscores the importance of the present study. The primary goal of this retrospective study was to evaluate the safety and efficacy of PLC in cats with intervertebral disc herniation. The researchers aimed to analyze preoperative neurological status, cross-sectional imaging features of the disc, the morphometry of the surgically created slot, outcomes, and complications. Their hypothesis was that PLC could be a safe and effective treatment option for IVDD in cats, similar to its use in dogs. The study included 12 client-owned cats treated at 2 teaching veterinary hospitals and 1 private referral hospital between 2005 and 2023. The inclusion criteria were thorough medical and neurological evaluations at presentation, spinal cord imaging, PLC as treatment, assessment of complications, and post-operative outcome assessment. Data gathered for each cat included information such as breed, age, weight, sex, clinical course before presentation, neurological examination results before surgery, diagnostic imaging findings both before and after surgery, details of the surgery performed, complications, post-operative care, neurological status after surgery, outcome, and the duration of the follow-up period. The clinical course before presentation was categorized as either acute, if neurological signs developed within a week, or progressive if they developed over a longer period. The neurological status of each cat was assessed using the modified Frankel score, or MFS, which ranges from 5 to 0, with 5 indicating pain without neurological deficits and 0 indicating paraplegia without intact nociception. Spinal imaging was done using MRI and CT scans, sometimes using contrast agents. The location of the intervertebral disc herniation was recorded, and the surgical procedure was performed following the protocol originally described by Moissonier, based on the imaging results. Specialist surgeons performed all surgeries. They measured the degree of spinal cord compression, evaluated lateralization and mineralization of the herniated material, and calculated the slot morphometry when imaging data were available. Spinal cord compression was categorized as mild, moderate, or severe, based on the percentage of compression. Lateralization was described as central, slightly lateralized, or obviously lateralized. The degree of mineralization was categorized as no, moderate, or pronounced based on its signal intensity on imaging. The postoperative spinal cord compression was then categorized as complete decompression, good decompression, or insufficient decompression. The slot dimensions were calculated in 3 ways, based on CT or MRI images: depth, height, and length. The depth of the slot is the lateral extension, height is the dorsoventral extension, and length is the craniocaudal extension. These measurements compared pre- and postoperative images to determine the percentage of bone removed. Finally, the postoperative outcomes were categorized into 6 grades, from excellent to death. The results section of the paper is supported by 3 tables and 3 figures that add to the clarity of the study. Figure 1 illustrates the different imaging modalities used to visualize disc protrusion. Panel A is a transverse CT image with a soft tissue window. Panel B is a horizontal myelo-CT image with a soft tissue window, and Panel C is an MRI T2 weighted image, with arrows indicating the disc protrusion. Figure 2 provides examples of imaging used to measure slot extension. Panel A is a transverse CT image of a slightly lateralized severe compressive disc protrusion, with an arrow indicating the protrusion. Panel B shows the same disc protrusion on a sagittal CT image with the cranial extension also indicated by an arrow. Panel C shows a transverse CT image after partial lateral corpectomy, and Panel D is a sagittal CT image after PLC. The figure also indicates the lateral slot extension, X, dorsoventral slot extension, Y, and craniocaudal slot extension, Z. Figure 3 shows the sagittal and horizontal CT imaging of a pronounced mineralized disc herniation at the level of T12-13. These are indicated by arrows. Table 1 lists the preoperative neurological assessment and imaging results of the 12 cats. It includes the case number, age of the cat, clinical course, modified Frankel score, imaging technique, location of the disc herniation, compression, lateralization, and mineralization. Table 2 lists the postoperative imaging data sets and outcomes of the cats. It includes case number, imaging technique, slot morphometry, lateral, dorsoventral and craniocaudal dimensions, the amount of bone remaining in each dimension as a percentage, the decompression status and outcome, and follow-up time. The study included 9 purebred cats and 3 domestic shorthairs. The mean age was 7.8 years, and the mean weight was 4.3 kilograms. 7 of the cats were spayed females and 3 were castrated males. The study found that 7 cats had severe spinal cord compression, 4 had moderate compression, and 1 had mild compression. The most common location for disc herniation was at the level of TH12-13. The study also found that the clinical course was progressive in most cats with mild neurologic signs before surgery, but 4 cats showed an acute onset of more severe signs. After PLC, 2 cats had insufficient decompression, 5 had good decompression, and 2 had complete decompression. In terms of outcomes, 5 cats showed excellent results, 3 had significant improvement, and 1 showed mild improvement. However, 3 cats died either during surgery or shortly after due to severe hemorrhaging, and 1 cat was euthanized due to neurological deterioration 5 months after surgery. The median follow-up period was 13.2 months. The discussion section of the article interprets the results in the context of existing knowledge. The researchers found that their hypothesis, that PLC is safe and effective, was only partially supported by the data, with a mortality rate of 25% associated with the surgery. This is significant as there are no previously reported fatal outcomes due to intraoperative hemorrhage in decompressive thoracolumbar spinal surgeries in cats or dogs, according to the authors of the study. Although hemorrhage is a known complication of this surgery in dogs, this study indicates it may be a more critical risk in cats. The authors note that blood loss needs to be closely monitored in cats because they have lower blood volume relative to their body size. The study suggests that cautious slot drilling, avoiding disruption of the dorsal longitudinal ligament, and the immediate availability of blood transfusions are critical for managing hemorrhage. The study also discusses the effectiveness of PLC. While the procedure improved the neurological status of all cats that survived surgery and the perioperative period, the degree of decompression achieved varied. Complete or good decompression was achieved in 7 of the 9 cats with post-operative imaging, and 2 cases showed insufficient decompression. One of the cats with insufficient decompression showed improvement despite this, while the other died. This highlighted that sufficient slot creation in all 3 dimensions is important for adequate decompression. The slot dimensions found in the study tended to be smaller than those recommended for dogs. This may be due to the smaller size of cats and a lack of experience with the procedure in cats. It was also pointed out that feline vertebrae differ from those of dogs, which may influence slot creation and the dimensions required. The study highlights that there is a lack of studies investigating the optimal slot dimensions in cats, making it challenging to determine the best approach. The study also notes that middle-aged and purebred cats were the majority of cases in the survey, which is consistent with other studies of feline intervertebral disc disease. Most cats in the study had a progressive onset of neurological signs, but some had an acute onset. The disc herniations were found to be slightly lateralized or central in most cases, but some were obviously lateralized. The study also found that a more mineralized disc was commonly found in chronic herniations. The study found that all cats with pronounced mineralized disc material showed severe spinal cord compression. It was also observed that those cats that did not have significant mineralization and had a better decompression had a better outcome. The distribution of affected discs was predominantly in the caudal thoracic and cranial lumbar vertebral column. This aligns with established data on where intervertebral disc disease is most commonly found in cats. The study points out that the biomechanical positioning of the feline vertebral column may contribute to this finding. The absence of the intercapital ligament in the region caudally to T11 was also noted to contribute to increased prevalence of IVDD. The discussion also notes that MRI was the preferred imaging modality in most cases, and that when MRI was done, a CT scan was also conducted for better imaging of the bone structure for surgical planning. Myelo-CT was also used. MRI and myelo-CT are highly sensitive in detecting IVDH. MRI is a non-invasive method that can provide better prognostic information for feline spinal disease than other imaging techniques. The researchers also acknowledge the study's limitations, which include its retrospective nature, the absence of a control group, and the variability in neurological assessment, imaging techniques, surgical procedures, and post-operative evaluations. The sample size is also small, precluding statistical analysis. The study, despite its limitations, provides important preliminary data for future research. The authors suggest the importance of intraoperative monitoring of blood loss, particularly given the consequences of hemorrhage, and more prospective studies with standardized protocols are warranted. In conclusion, the study confirms that PLC is a feasible decompressive spinal surgery in cats. However, it also underscores the risk of surgical complications, with a 25% mortality rate. The authors emphasize the importance of meticulous attention to adequate slot creation in all 3 dimensions to obtain proper decompression, and the importance of managing intraoperative hemorrhage to ensure a positive outcome. Despite the risks, the study also indicates a favorable prognosis for cats who undergo PLC without complications. This study provides valuable insight into the challenges and possibilities of treating intervertebral disc disease in cats. It is clear that more research is needed to refine this technique and further understand the intricacies of feline spinal health. From VetNeuroJar. Keep those minds inspired, hearts light, and tails wagging.